Hi, everyone. This is Kylie Barber. I am the Medical Foods Policy Associate at the National PKU Alliance in partnership with the Every Life Foundation for Rare Diseases. And today I am so excited to be here to talk to you about the Medical Nutrition Equity Act of 2021 and prepare you for Rare Disease Week 2021. And I just wanted to talk a little bit about my position and let you guys know that my position is fully funded by the National PKU Alliance, and I work every single day on behalf of the PKU community to advocate and provide insight on public policy issues. Okay, so the Medical Nutrition Equity Act of 2021 is a bipartisan and bicameral piece of legislation. It was reintroduced in both the House of Representatives and the Senate early this month of June. We are very excited about that. I know a lot of advocates have been anxiously awaiting the reintroduction, and we finally got it. So congratulations to everyone who went to work on that to help us get that reintroduction. So the Medical Nutrition Equity Act is a bill to provide for the coverage of medically necessary food and vitamins and individual amino acids for digestive and inherited metabolic disorders under federal health programs and private health insurance to ensure state and federal protection for existing coverage and for other purposes. So the bill, the House bill number is 3783, and our champions in the House are Representative Jim McGovern, who is a Democrat from Massachusetts, and Representative Jamie Herrera Butler, who is our Republican from Washington State. The Senate bill is S-2013, and our champions in the Senate are Senator Bob Casey, Democrat from Pennsylvania, and Senator Joni Ernst, our Republican from Iowa. So I wanted to talk a little bit about why this year is our year more than ever for the Medical Nutrition Equity Act. And the main reason is because all bodies of the US government are in favorable majority for the Medical Nutrition Equity Act. So including the administration, including the House of Representatives, as well as the Senate, are all Democrat majority, which is favorable to the Medical Nutrition Equity Act. So what does that mean? That means this is our year. We need all of your efforts. If you were going to engage in this issue at any point in time, this would be the time to do it. And the idea is to get as many co-sponsors on the bill as possible before August, hopefully to show Congress that this is an important issue and they will take action on it, potentially bringing it to the floor or attaching it to a larger bill. Okay, so what exactly does the Medical Nutrition Equity Act do? So it provides coverage under federal health programs and private insurance for the treatment of children and adults with certain digestive and inherited metabolic disorders, including medically necessary foods, including formula and low protein modified foods, vitamins and amino acids, as well as the equipment and supplies required for administering medically necessary foods. It also amends TRICARE coverage to include immunoglobulin E and non-immunoglobulin E mediated food protein to the list of covered conditions. So basically, it provides a federal floor for coverage. And something that's important to note, it does not preempt more rigorous state laws that may exist. So if there exists a state law that is more beneficial to patients, the Medical Nutrition Equity Act would not override it. It just, again, elevates existing state laws that maybe are lacking. Okay, so who is covered under the Medical Nutrition Equity Act 2021? So the term covered disease or condition includes inherited metabolic disorders, including those listed on newborn screening, on the newborn screening panel, medical and surgical conditions of malabsorption, immunoglobulin E and non-immunoglobulin E mediated allergies to fruit proteins, certain digestive conditions, including Crohn's disease, ulcerative colitis, and others, and any other disease or condition that is determined by the HHS secretary. If you're interested in more details on what exactly is covered as far as conditions go, There are more details provided in the actual text of the legislation, and as well as a list is provided on the Patients and Providers for Medical Nutrition Equity Coalition at nutritionequity.org. Okay, so what exactly are these mysterious medical foods? And if you have a chance to meet with your members of Congress, this is going to be a question that you will be asked. I think when we use the term medical foods, foods rings true, to a staffer or a member, and they, automatically assume that they're groceries. If you're familiar with the issue and you have, one of these conditions, you know that they are not normal groceries by any means. So the term medically necessary food means food including a low protein modified food product, an amino acid preparation product, a modified fat preparation product, or a nutritional formula that is furnished pursuant to the prescription, order, or recommendation of a qualified healthcare professional for the dietary management of a covered condition. Also, a specially formulated and processed product for use of feeding by means of oral or enteral intake, and is also intended for the dietary management, which cannot be achieved by modifying a normal diet. They also require medical supervision. And so I think a lot of times the confusion, at least my experience on the Hill, is, staffers or members, again, think that they are normal products, grocery products that you can find at a grocery store. And as you meet with your members of Congress, it's important to emphasize the difference, as well as including the cost, because as you well know, medical foods are at least, about 6 to 8 times more expensive than regular groceries, and they are medically necessary. Okay, so what is different about the Medical Nutrition Equity Act this year as opposed to past years that we've had the Medical Nutrition Equity Act in Congress? So changes to the legislation include highlights about the out-of-pocket impact of the COVID-19 pandemic on patients and their families who require medically necessary nutrition. We also put a clause in there that requires the secretary to consult the Agency for Healthcare Research and Quality, as well as other scientific entities to determine coverage of added conditions. So if we come across an instance that we feel a condition would benefit from being added to the Medical Nutrition Equity Act, the agency is required to go through a rigorous process, again, consulting scientific entities to determine whether or not that would be beneficial to add it to the Medical Nutrition Equity Act. It also specifies that medical equipment and supplies necessary to administer such food is covered on a needed basis. Also establishes that coverage applies to patients with specified diseases or conditions versus because of therapeutic or chronic medical necessity. Okay, so let's talk about advocacy. This is the fun part, right? So how to foster a meaningful relationship with your members of Congress. And this is critically important because it's through the relationship that anything really gets done in Congress. And so if you have the ability to have a personal relationship with your member of Congress, they will lend a special ear to you and have extra motivation and put extra effort into the issues that matter to you. So how do you do this? So begin by scheduling a meeting with your member in the district or on Capitol Hill if you have the chance to come to DC. It's a wonderful place. Next is get to know the key staff who handle health issues in the district, as well as in Washington, DC. And this is key because staffers are sort of the gatekeeper. If you can't get access to your member, the staffer is the next best thing. And not only, the second best, a lot of times it's the best option because they're the ones who inform the member of the issues and counsel the member, on the decisions regarding the issues. Invite your member of Congress or their staff to events held in your community. Attend events like town halls that your member of Congress holds in the district and the state. Volunteer for candidates' campaign activities. Engage with legislators on social media. Write letters or emails to your legislators. write op-eds for your local newspapers. And this one is actually pretty important because your members of Congress mostly pay attention to local news, what's going on in the district. And if you can make some noise in your district and get their attention, that can be pretty impactful. Also send thank you messages. I think a lot of times members of Congress get a lot of asks. And so whenever they can be thanked for their efforts, as long as they, are deserved so, they also, obviously appreciate it. So always remember to say thank you for your meetings and any interactions that you have with your members. Okay, advocacy continued. So questions to consider. When should I engage with my representative and senators? Anytime and all the time, any chance you can get. I would say start out slowly with 1 or 2 different activities as issues arise related to the Medical Nutrition Equity Act or the PKU community. Engage your legislators on those issues. Pay attention to the issues that you care about most. As the Medical Nutrition Equity Act progresses through Congress, either through committee, House vote, Senate vote, conference committee, etc., let your legislators know about the position on the issue. Let them know that it remains important to you and is your #1 priority. Also, don't wait until it's too late to voice your support or concerns on legislation that you care about. So how do you connect with your legislator? Find personal connections you have in common. As a constituent, you are from the state and area the same state and area as your legislator. You may live in the same neighborhood, go to the same school, etc. Research the issues that are important to your legislator. You can check out their website and press releases as well. Each member generally has a handful of issues that they go to Congress to make an impact on and prioritize. So make sure that you're familiar with those. And again, research the legislation that your legislator has supported in the past. Again, you can find this information on their website as well as press releases. Okay, so another important part, especially in this virtual world that we have been living in, is social media. So how can you use social media for advocacy? It seems intimidating, but I think once you get the hang of it, it's pretty easy and pretty convenient. So you can use social media like Facebook or Twitter, Instagram, whatever platform, in a variety of ways to engage your members on social media. And help make them aware of the problems you and your community face, as well as thanking them for actions they have taken, like co-sponsoring a bill, voting a certain way, etc., and make them aware of how pieces of legislation would affect you and your community. So what is a hashtag? So on Twitter and Facebook, the # turns any word or group of words that directly follow it into a searchable link. This is important because you can tag hashtag MNEA 2021. You can also, with the @ symbol that tags your members of Congress's Twitter to bring attention on the issue. So if you want to post about Rare Disease Week, as well as the Medical Nutrition Equity Act, you would include hashtag RareDC 2021 in your post to join the conversation. You could then click the hashtag to see posts from other people who have used the same hashtag. So how do I mention someone on Twitter? And this is what I was talking about with the @ symbol. So many members of Congress and congressional offices have Twitter accounts to interact with constituents. It's either that or Facebook, I've found, are the most prevalent ways of communication. So if you know your member's Twitter name, you can mention them in your post, for example, Senator McGovern or Senator Smith. If you don't know your member's Twitter name, again, you can check his or her official website. Social media continued. If you're meeting with your legislator in person, it is a great idea to highlight your meeting on social media before and after you go into the meeting. And this is a great idea to start thinking about before Rare Disease Week and sort of have a plan going into the meeting. So #1, before the meeting, create a post tagging the member's office and the Medical Nutrition Equity Act. During the meeting, ask to take a photo. And in this event, it's actually going to be a screenshot. Again, we are living in a virtual world. We hope to return back to the Hill in person within the next year, but it's still very important to remember to take a screenshot of the advocates as well as the staffer or the member of your meeting. Also take notes during the meeting so you can include key information or good quotes in your posts about the meeting. And after the meeting, post your picture with the member or staffer with a thank you on Twitter and Facebook, emphasizing the key points they discussed during the meeting. And this is all great advocacy information, and there's many more advocacy tools that you can find on the Every Life Foundation under the Resources tab. Okay, so Virtual Rare Disease Week on Capitol Hill 2021. So Virtual Rare Disease Week on Capitol Hill brings together rare disease community members from across the country to be educated on federal legislative issues, meet other advocates, and share their unique story with their legislators. This is a great opportunity to once again rally with the PKU community and join together to lobby our members of Congress for the Medical Nutrition Equity Act. So Virtual Rare Disease Week on Capitol Hill 2021 will be held July 14th through July 22nd and will include the same opportunities as in-person Rare Disease Week, plus a whole bunch more, and a lot more convenient because, again, you're doing it right from your house. So some of the activities of Rare Disease Week include the Rare Disease Congressional Caucus Briefing, which the title is Rare Disease Therapy Development, Existing Challenges and Proposed Innovative Solutions. Rare Disease Documentary Screening, and the documentary screening that we will be screening this year is called A Mystery to Me. We will have 2 legislative conference days to get you up to date on not only issues regarding the Medical Nutrition Equity Act, but also the broader rare disease issues which are important to be up to date about. We will also include a rare artist gallery, and we will have YAR activities, which are young adult representatives of rare disease legislative advocates, which will include a meetup, as well as an academy graduation. And of course, the most important part are the virtual meetings with your members of Congress. Also, for a complete list of Rare Disease Week 2021 activities and schedules, you can log on to the everylifefoundation.org under events, and you can find everything that you need to know about Rare Disease Week there. Okay, now is time for your questions and comments. We will take about 10 to 15 minutes or so. So if you have any questions or comments for me, go ahead and provide them in the chat, and I will try and answer as many as I can. Thank you so much, everyone. Hey everyone, it's Kylie. Again, like I just said on the recording, go ahead and submit any questions you have in the Q&A, and we'll take as much time as we can get to answer them. Okay, so from Blythe, it looks like we have, can I share the link to Rare Disease Week activities in the chat? Yep, you bet I can. Let me get that for you guys. One moment. Okay, that link should be in there. Let me know if you didn't get it, and I can resend it. Okay, so from Heidi Maxfield, she says, and this is a great question because it is truly the nature of advocacy sometimes. So she asks, how do we get senators on board who have repeatedly refused to sign on? Well, That's a really good question. Don't vote for them, obviously, right? Try and get them out of office. No, that's kind of a joke. But really, again, it's just going to be your relationship with the senator or member of Congress. The more personal you can get, the more that they can relate to your issue and really see, the impact and the burden that it is on your life. The more likely they will, be motivated to sign on. But at the end of the day, some senators just won't, whether it's the issue sort of conflicts with their agenda, or, there are some senators who are really principally based and just for whatever reason won't budge on the issues. But again, I've seen cases where some representatives or senators have been opposed to the issue, but through some connection or some relationship, they were able to see the light and then change their opinion. So persistence really is key. But also, when you are persistent, it's important to be pleasant about it. Again, you want to always have positive interactions with your members of Congress, so they keep, responding and coming back to you. Okay. And then Heidi responds, our senators have refused to meet with us in person. It's very disheartening. We've met with all their staffers. We'll keep trying. And that really is the attitude. And I'm glad, Heidi, that you're sharing this, because I think that's the experience of a lot of advocates. But I appreciate your guys' resilience and, unwillingness to give up. I think, again, that really is key. Okay, what else do we have? All right, let me check a couple more places for questions. Again, we have a couple more minutes. If you have any questions or comments, go ahead and submit either in the chat or the Q&A. We'll try to get to them. Sarah, also, thank you for sharing that. Shared the coalition website on the chat. She says it's brand new social media page with a pre-written Twitter post regarding the Medical Nutrition Equity Act and links to Facebooks or the Facebooks of the members of Congress. So that's really, really helpful. So I encourage everybody to click on that link. It's the nutritionequity.org link and check out that website. Okay, so great question, Nicole. So Nicole asked if we can still sign up for Rare Disease Week. You can, although you are unable to sign up for the opportunity to meet with members of Congress. You can sign up for, the legislative conference as well as the other activities, but unfortunately we had to cut off scheduling additional meetings for members of Congress, just, for scheduling purposes and to, lock everything in. So again, you can sign up for the activities, absolutely, but to sign up to meet with your members of Congress, that's been cut off. Okay, so Annie Prince, great question. What is the timeline for approval or disapproval of the bill? So each session of Congress lasts 2 years. And so I believe this is at least the 10th year that we've had some sort of legislation in a session of Congress. So every session it starts over. So within the next, year and a half or so, before the next session of Congress starts, ideally we would get this bill passed. But again, if it doesn't happen, we would start back over in the new session of Congress in the 118th session. Okay, you guys, it is now time for me to turn the time over to Christine Brown for some closing remarks. And again, I just want to thank everyone for your participation and your willingness to advocate on behalf of the Medical Nutrition Equity Act. Thank you, guys.